I've been working with laser oncosurgery for the last 12 years, and we've done a huge amount of work in laser oncosurgery. And laser oncosurgery is, I would say, the next gold standard for cancer patients, because we have always been looking for a treatment option in which you can destroy the cancer without operating. You understand? For two reasons. One, for the patient, and because patients do not want mutilation, because whenever I'm talking about breast and oral cancer. So ladies don't want the breast removed, and none of the patients want half of their face removed. So if you can have an option where you can keep all these things intact, okay, and use the present oncology principles or the oncology drugs, which by the way, are just fantastic at work. All they need is a minimum tumor load to act. But unfortunately, what happens is that when we are doing conventional surgery, there are two things which happens. One is the surgery itself spreads the cancer. So we keep on chasing that spread all around the body. And two is, in oral cancer, it causes a huge amount of problems which in the long term are not reversible, right from mouth closure to gingivitis to feeding problems, speech problems, and frankly it leads to a huge amount of depression in the patients. So they are not it's more like a punishment rather than a treatment, and that goes for breast cancer too. So if you're taking somebody's breast off and expect them to go and forget about it, everything is fine, it doesn't work that way. So there are a lot of marital problems, there are a lot of depressions, there are a lot of divorces happening because of breast cancer surgery. And that is where laser comes in, because laser can destroy the tumor, and this is done under sonography control. So we know exactly how far the tumor is, and then we follow up the patients. If there's any small recurrence, it can still be laserized, which is another 1 or 2 minute job. So all in all, there's no cutting involved, and there's no mark. In fact, I always tell people the future of surgery is no surgery. Whether we like it, we don't like it, it's all around us. And cancer was immune to it for a very long time, but now laser has caught up with that. Conventional cancer treatment is basically based on skill sets of the surgeon. So it involves a lot of operation theatre time, a lot of cutting. So you're cutting everywhere and trying to remove the cancer. And laser does away with all that. So the timing is probably just about half an hour to 45 minutes. You do the whole procedure under sonography control. You can actually see the tumor on sonography. Then you put the procedure is done percutaneously, and you can put the laser inside the tumor, and then it depends on the laser skill sets to ablate or burn or fulgurate, whichever word you prefer, to destroy the tumor. And that is something you can make out on sonography itself, and the sonologist has to be skill set in that. So there has to be a retraining of all the surgeons in laser, and the results what we have seen quite frankly are outstanding. Laser is currently being used in select situations in brain cancer. Oral cancer, yes, you can use it in throat cancer. You can use it in thyroid cancer. We've used a lot of it in thyroid cancer, and there are a lot of papers on the subject also. And breast cancer, you can use it in recurrent cases inside the chest. That if it's the periphery lesions of the lung, you can ablate them, burn them, rather than trying to open up the chest. the body absorbs the dead material on its own. And lower down you can get it in liver. Lot of work is being done in ablation techniques of liver. So plus prostate, there's a lot of work being done in prostate as well. So having said that, I said it is catching up now. Laser is catching up in oncology, and we are very definite and we are very sure in the next 10 years laser is going to be the new platinum standard. See, first of all, we all have to realize that we feel that 100% of the cancer should be out. Practically, it is not possible. So whatever is being removed is a part of cancer, which is what we call in layman terms swelling. So when we remove the swelling, we try to remove a margin around it. So that margin is either a pathological margin, which is very small, maybe 5 millimeters, 3 millimeters, or it may be a clinical margin, which will be about 1.5 centimeters. But in many cancers, in most of the cancers actually, the tumor will have seedlings outside the margin level. This is the primary reason why chemotherapy is given. Chemotherapy should not be used for treatment of the swelling or the tumor. You understand? It is used for chemotherapy, is used for the cells which are around the tumor. So that will remain. But now the chemotherapy has a much better effect because the tumor load is 99% gone. That is the primary reason why you are doing surgery in the first place. If surgery could remove 100% of the cancer, then why would you give chemotherapy, radiotherapy?
Exactly, yeah.
You understand? So laser also does the same thing. Laser would remove under radiological control maybe 99% of the 95, 99, it all depends on what the size of tumor is. And then the rest of the treatment is conventionally by chemotherapy. But having said that, there is a difference. Now we don't need very high doses of chemotherapy. You understand? So specifically in our practice, we use almost like 50% of the dose of normal chemotherapy. So most of our patients tolerate it quite well. And in fact, we tell them to eat well, and we give all the other instructions like no sugar, you can't go back to your tobacco or whatever other issues. And we have seen patients gaining even 10 kgs in 6 months on chemotherapy.
Oh wow, that is
on chemotherapy. So we had to rework the whole of oncology around the patient. Right now, most of the oncology what we are doing is around the doctor, the hospital, the departments. No, you have to rework it around the patient. So even in chemotherapy, we don't have a standard dose. We will, for example, if the patient is a 75-year-old person, we would not do it with a BMI dose. We would cut down the dose by another 50% so that he's able to tolerate, rather than having him land up in ICU and things like that. In two ways. First of all, it does not need major hospitals to do this. The equipment which you require is available off the counter. So you can have a laser machine, you can have that's not a problem. The sonology, so sonography machine is not a problem. And the skill sets of the sonologists are always available. And the operation theatre is not a problem because you don't need a very major operation theatre because the timing itself is just about 1 hour for most of surgeries. There's hardly any blood loss, so you don't need blood banks, standing by for an operation. And the recovery time is 24 hours. So you can do it in smaller hospitals, you can do it in smaller places which don't have a huge $100 million hospital behind them. And the best part is that you don't need onco surgery skill sets. So you can have it with an ordinary ENT surgeon or even a general surgeon, which, as anybody knows, general surgeons would be much more in number than an oncosurgeon, and they would be available in many Mofussil areas, which an oncosurgeon needs a first referral area. Now you can have it in a hospital which is just about 20 beds, and you get a much better response, because if it, for example, in places which are in developed countries, so by the time the patient comes to the main center, by the time he comes to the main center, he is already gone from stage 1 to stage 4. And stage 4, as you know, in conventional surgery is really not curable. Okay, and we can do a lot of it in laser, that's a different issue. But it's always better to catch it early. And there's hardly any expense involved. So most of the treatment can be done in maybe less than, I would say, if you want to bring it down, you can bring it down to less than $800. That includes surgery and chemotherapy. We are trying our level best to educate people. We have been fairly successful because of the internet. So the patients are demanding now from their surgeons that we want to do laser, but there is a problem of stepping over the boundary and taking a leap of faith. So we invite everybody to come and have a look at our center in Bombay, whichever part of the world you are from, and come and see the patients. And even if you attend about 2 sessions in our OPD, you'll realize that this is what you want in your country, rather than, and this is what the patients want at the end of the day. So we were always looking for a treatment which would be more patient-centric and a better treatment in terms of overall survival. OS, as they call it in oncology terms. So better OS and a better quality of life. So we call it better quantity of life and better quality of life. So both these things are available now with new laser technology. Yeah, we've got we've got a abstract for a presentation for patients which we did in the last around 10 years, and the results we are showing on photographs with the photographs, and I feel it's very apparent that once you see the before and after pictures with the time frame, that this is the new revolution, and I invite everybody to be a part of it for the for the betterment of the patients. And I always say now, because I've been a surgeon, I have not taken up a knife in the last 10 years. And at the end, we would like just to say that the fight with cancer starts now. Well, I'm here at World Cancer Congress, so that's one part. And I'm inviting a lot of people. We've got these posters, we've got these folders, and we are inviting people because I've realized 99% of cancer professionals are not even aware that this wonderful treatment is already in, and it is US FDA approved. So US FDA knows about it. It's part of the NCCN guidelines, though not as in guidelines, but they have mentioned it in NCCN guidelines. And I'm trying my level best with the Ministry of Health in India to take this forward. We have got our YouTube channel, Orchid Center for Laser Surgery. We get inquiries from all over the world. I feel a lot of people should, look for alternatives in the field of laser in whichever cancer, because there are only so many people who are doing laser for cancer all over the world, and that is a very precious community. And I would advise most of the surgeons to actually look at it very, very seriously, because this is going to be the future. So whether you like it or not, we do about close to 30 to 40 operations every month in our center, and that is without any advertisement or anything. It's just word of mouth. So about 50% of the cases we are now getting are after now 5-7 years is just word of mouth that we've done his uncle or his some relative, and he's cancer free at the end of 3 years. So he is obviously recommended laser. And it's a technology which anybody can master in very less time. And we are here to, handhold any surgeon who wants to, go through this and upgrade himself. And yes, sadly, there's an issue that we all love surgery, and we have huge egos as surgeons. And but I think those egos have to be left aside when you consider, the future. And the future of surgery, as I again say, is no surgery. It's in gastroenterology. We gave up gastroenterology long back to medical guys, to the cardiac wise, that bypass surgeries has been taken over by angioplasty. So these are all examples of no surgery. And oncosurgery is also going to be part of that. And it's all around us. We just need to be aware of it and look at it seriously and upgrade ourselves.